Dear Chairman, ladies and gentlemen, I'm Dr. Yunnan Lin. It's my honor to present this topic in this great meeting. Diamonds are the same shining on the fingers of the elderly or the hands of young people, but it is obvious that the diamonds look more dreamy on the fingers of young people. And how to do this. Lin et al. Proposed the concept of micro-autologous fat transplantation in 2007 and established the confidence of surgeons and provide an innovative strategy for this historic procedure. The feasibility of MAF to aging dorsal hand and its long-term follow-up are not addressed in literature. In this study, we investigate this issue and propose the conclusive technique. This is a picture of aging hand. There are features related to subcutaneous tissue atrophy, such as gouging vein, obvious shapes of tendons, subcutaneous atrophy, and wrinkling skin. And we think fat grafting as a filler is a good choice for correcting aging hand. And this is our topic today. We are going to talk about how fat grafting works and how to put it into the correct layer and make sure that we can get the most satisfactory result. This is a hand grading scale, which is a 5-point photonumeric rating scale. It is used to quantify the severity of aging hand, and in our study, we apply this grading scale to measure the result. During the period between 2011 and 2020, there were over 100 patients receiving MAF for treating aging hand. And we use the concept of MAF. Fat was harvested by performing liposuction, and purified fat was grafted to the dorsal hand with the assistance of MAF gun. In the next few slides, we briefly demonstrate the MAF technique. We harvest fat and process through centrifugation, then transfer condensed fat to one more syringe, and loading fat-filled one more syringe to MAF gun. We inject fat graft with blunt-tip needle at subcutaneous layer to avoid injury nerves and vessels through 4 insertion sites over finger web space. Fat parcels are injected into 3 layers, which are dorsal superficial lamina, dorsal intermediate lamina, and dorsal deep lamina with MAF gun. This is a live demo of how we inject the fat parcel through insertion site in 3 different subcutaneous lamina, and we can do it by single surgeon, and we identify 3 different lamina by anatomy site. You can see the superficial lamina. We inject and we change one more syringe by one hand and inject the fat parcel again. These are the patient characteristics included in our study. Mean age of our patient was 52 years old, and total procedural time of mouth aging dorsal hand were 72 minutes, and mean volume of purified fat graft over right and left were about 20 mol, and mild swelling resolved in 1 week, but no major morbidities was recorded, and mean follow-up period was 46 months. All patients included in our study were satisfied with the result and long-term outcome. Mean hand grading scale before procedure was over 2, and after the procedure, the mean grading scale was below 2. In the next slides, we demonstrate 3 cases of pre-op and post-op pictures. And this is the case 1, 70 years old female. Pre-op, the hand grading scale was 4. And after the procedure, the grading scale was down to grade 2. And this is the case 1, another hand. Before procedure, the scale was grade 4. And after the procedure, the grade was 2. And this is case 2, 62 years old female. Before the procedure, the grading scale was 3. And after the mouth procedure, the grade was down to 0. This is the right hand. Before mouth procedure, the grade was 3. After the procedure, the grade was down to 0. The last case was 54-year-old female. Before the procedure, the grading scale was 3 of her left hand. And after the procedure, the grade was down to 0. This is her right hand before mouth procedure. The grading scale was 3. And after the procedure, the grading scale was down to 0. Using the mouth concept to rejuvenate aging hand is not only simple, but also avoids central necrosis and its subsequent complications. In the conclusion, the concept of mouth introduced in 2007, the application of fat in the rejuvenation of aging hand shows satisfactory outcome in long-term follow-up. With the innovative medical device, fat grafting is a precise, reliable, simple, promising, and consistent procedure. Thanks for your listening.